Hello everyone and welcome back to Neuropsychology. So in the last lecture we talked about a bunch of different ways how we look at the brain in neuroscience. So some of them were electrical recordings, we talked about single unit recordings and optogenetics, which are both really cool methods of researching the brain. And we also talked about dynamic brain imaging, in which we have PET scanning, MRI scanning, and within MRI you have diffusion weighted imaging and functional magnetic resonance imaging. So here you can see a part of single unit recordings where you have a little drive that you drive down into the brain. Here you can see a picture of optogenetics where this cute little rat has a light attached to it, and there it can turn on and off brain regions. And here you have the MRI scanner, which is at FIU at the MMC campus. So today we're going to talk about electroencephalographic recording, or EEG for short. I'm sure you guys have heard of that before. Then we're going to talk about event-related potentials, which is technically a part of EEG. So we'll dive a little deeper into that. Then we're going to talk about magnetoencephalography. It's a long word. Then we're going to talk about some various forms of brain stimulation, including deep brain stimulation and some other methods. And then we're going to talk about Xrays and CT scans, etc. So let's dive a little deeper into that. Okay, so we are going to cover three techniques to record electrical activity in neurons. So one of them we talked about in the last video, which was the single unit recordings. And in this video, we're going to talk about EEGs, or electroencephalograph recordings, and also about ERPs. So remember that EEGs and ERPs and single cell recordings are all three techniques for electrical recording. So you're measuring the action potentials and the graded potentials. So EEG recordings record electrical activity in the brain. Simple as that. So electro means electrical and encephalo means brain. So it is used to track and record brain wave patterns. So EEG can determine changes in brain activity that might be useful for diagnosis in certain brain disorders. So one that it's often used for is epilepsy, and sometimes also for other seizure disorders. So EEGs might also be helpful for other diagnoses that have to do with sleep studies or monitoring the depth of anesthesia during surgery. So you can also use it to study brain functions and diagnose and monitor the seizures that we just talked about. So it is technically a test that uses very tiny small metal discs, and these are called electrodes, as we talked about prior, and these are attached to your scalp. So often this is in kind of like a shower cap kind of idea, so it's easier to put on and take off. So when your neurons create these action potentials and then communicate with one another, this activity will show up as wavy lines on an EEG recording. Okay, so again, in EEG, we have these tiny electrodes that are attached to your skull, and sometimes in the form of a cap, as I just said, and it kind of looks like a shower cap, as you can see in the picture. So then often they use another electrode that is pasted on another area where there's no brain activity. So in this case, I used an example of an earlobe. So then these two electrodes have a difference in electrical potential, and that is what you can measure. So that is then the underlying brain activity. So since the tetrodes are on the outside of your head, they can only measure brain activity on the outside layers of your cortex, of your brain. So with EEG, you cannot measure electrical activity deep inside of the brain. So for example, the hippocampus and the amygdala are too deep inside of the brain for EEG to reach this. It's only for the outside cortex of your brain. So remember when we talked about graded potentials in the dendrites and cell bodies of neurons? Well, these are the electrical activity that these EEG tests measure. So when there are graded potentials in the outside cortex of the brain nearby the electrodes, then these electrodes will measure this electrical activity. So this will then produce a little electrical fluctuations in the brain, and these measurements can be created into what they call polygraph. So a polygraph technically measures the graded potentials near the scalp of many, many neurons, so most likely thousands of neurons, as these electrodes are relatively large compared to all these neurons. So picture a neuron in your brain, and then many of them, and then these electrodes are pretty small as well to the eye, but your neurons are way smaller. So one electrode will measure thousands of neurons at the same time. So this is what a polygraph kind of looks like. This is a very old school one, probably made with a pen, but we're going to talk about that in the next slide or the slide after that. Okay, so here's a picture that I took from the book. So electrodes are attached to the skull, as you can see right here. So this person is not wearing one of those caps, but here it's just stuck onto the skull with some glue or something that pastes to it. So electrodes are attached to the skull, and they all correspond to a specific area of the brain. So for example, one electrode could be measuring electrical activity in the occipital lobe all the way back here. So an old school model, so they don't use this anymore, but I'm sure they still have some old models like this around. So polygraph electrodes are connected to little magnets, and then these magnets are connected to pens. And then that will create wavy little lines with a record of the electrical activity in the brain. However, this is not used anymore, and we use everything's automated and computerized, but this is what that kind of used to look like. Kind of looks like a lie detector, doesn't it? Okay, so different patterns of brainwave activity are associated with particular states of consciousness or behavioral states. So when a person is very aroused or excited or even just alert, the EEG pattern has a very low amplitude. So it has a low wavelength, and it has a high frequency. So it occurs more often per second. So we call this wave pattern beta rhythm. So this beta rhythm is typical of an EEG taken from anywhere on the skull for a participant that is very alert. So definitely remember that. So in contrast, when a person is calm and resting, or especially when they're closing their eyes, there will be larger and slower brain waves. So these are what we call alpha brain waves. And not everyone has alpha brain waves or alpha rhythms, and some people have them a lot. So it kind of differs between people. However, EEG is also sensitive enough to detect other states than just relaxed or normal. So as EEG rhythms become slower in frequency and larger in amplitude, theta and delta waves can be produced. So theta waves are when someone is drowsy or getting sleepy. You can see that right here. This is theta. So you can see that the amplitude gets a little bigger and the frequency is a little lower. And then delta waves are when people are sleeping. So they're deep sleep waves. So these distinct brainwave patterns make EEG a reliable tool for monitoring waking and other conscious states. So often people use this for sleep studies. EEG is therefore also very useful for estimating the depth of anesthesia. So if the brain stops functioning, or if somehow there's brain death, the EEG trace will become a flat line. So this is often what you see in movies with the heart rate, but you have the same thing for your brain. Okay, so EEG is also very useful in diagnosing brain injury, in which electrical signals may be abnormal or absent in damaged tissue. So epilepsy is characterized by changes in sensation, mood, consciousness, by convulsions referred to as seizures. So I'm sure you guys have all heard of that. So the causes of these seizures were technically unknown until people started using EEG experiments. And these EEG experiments demonstrated that different types are associated with the different abnormal electrical rhythms in the brain. So one form of epilepsy is called partial seizure or petit mal. And here, abnormal electrical discharges are restricted to only either a few brain regions or just one brain region. So partial seizure is associated with sensation or emotion changes or a brief loss of consciousness. By contrast, if you have in generalized seizures, or what I also call grand mal, the abnormal electrical discharge occurs widespread throughout the entire brain. So generalized seizures are characterized by abnormal body movement that includes convulsions. So these are also called tonic-clonic seizures. People can also sometimes fall down without any muscle tone. So these are atonic seizures. And sometimes they even get a loss of consciousness. And these are called absence seizures. So EEG recordings can provide information about the cause of epilepsy, but also its location. So the duration of an epileptic attack correlates closely with the duration of abnormality in EEG in the little waves that we just saw, such as distinct spikes or slowing or quickening of electrical waves, or sometimes there's even a quick loss in EEG signal. So here are some examples of that. So in the picture on the right, you see examples of the EEG pattern recording during a generalized seizure. So the dots on the hemispheres below, as you can see right here, you see the little dots. So these dots are the approximate recording sites. So the column numbers are the stages of the seizure. So you have 1, 2, 3, 4. So number 1 is typical. It's a typical record of before a seizure. And 2 is a typical record of the onset of seizure. And then in 3, you see the clonic phase of the seizure, in which the person makes rhythmic movements in time with which are tied to these large atypical discharges, as you can see right here. And then in 4, you can see the period of kind of like a coma after the seizure. Okay, so moving on to ERPs. Event-related potentials are brief changes in EEG signal in response to a stimulus. So people use this in the lab to measure responses or brain waves in response to stimuli. So ERPs are largely excitatory and inhibitory graded potentials, and the EPSPs and IPSPs that are sensory stimulus triggers on dendrites. So an ERP is not very easy to detect because the signal is mixed with other EEG signals from the brain. So don't get confused with the difference between ERP and EEG. So one way to detect the ERP is by repeatedly producing the stimulus or showing the stimulus and then averaging the recorded responses of the brain. So averaging out will cancel out irregular and unrelated electrical activity, and it will then leave only the graded potentials that are generated by the stimulus. So here you see a better picture of that. So let's go over how this works. So on the right, here you see it's when its first response, after 10 responses, and all the way down to 100 responses. So these are all averaged together. So in the beginning, you see the ERP response after a tone is heard. So the tone is here in red, and then you see the response after a tone is heard. And at the bottom, after recording more than 100 stimulus presentations, the distinct wave pattern of the ERP occurs. So I know these are switched, but this is just how some people reported, and this is often the raw data. So an ERP produces a number of negative and positive waves in a period of a few hundred milliseconds after the stimulus. So the EEG waves going downward are normally called positive, so as you can see right here. And then the ones going upward are called negative. And they're always numbered by when they were produced. So P1, N1, P2, N2, etc. So the great thing about ERP is that you can record from many different cortical sites, and this can indicate which area of the brain is responding the most. So ERPs are used to study normal functioning in the brain and also how people react to different stimuli or pictures or sounds. So therefore, cognitive processes that occur during learning about certain stimuli can also be measured. And we also use it to test for hemispheric differences and to examine planning and execution of movement, and it's used for much more. Okay, so here you see a person with the EEG electrodes in his head, and the electrodes are attached to his scalp. As you can see right here, these red things are the electrodes. And when the person sees a specific stimuli, in this case a rat or a rodent on a computer screen, a computer will measure the electrical activity for every electrode. And in this image, there will be a large positive wave on the right side of the posterior side of his head. So you can see that right here. So here you can see the ERPs. And if you use some clever computing conversions, you can create a color representation showing the hotspot for the visual stimulus. So again, EEG, they look for the ERP, and eventually they can create a picture of like, it's right there. Okay, moving on. We're going to talk about MEG. MEG stands for magnetoencephalography. It's a very long word, so feel free to refer to it as MEG. So we're not going to go into a lot of detail of MEG, but I do want to teach you about it. So I'm going to go over some details. So it's technically also using with a magnetic field. So when a magnetic field passes across a wire, it induces a current in this wire. So when a current flows along this wire, it induces a magnetic field around the wire. So this reciprocal relation between electricity and magnetism is also seen in the neurons, as we talked about. So by generating an electrical field, neural activity also produces a tiny magnetic field. So a single neuron produces a micromagnetic field, as we talked about in previous videos, but it's so small. So if you have many neurons together, you can record this magnetic field on the surface of the skull. So this is what MEG does. And MEG is technically a counterpart of EEG and ERP. So it just measures these averaged out magnetic field changes of our neurons. Okay, so the heart of a MEG is a sensing device containing a special superconducting coil, and that is needed to detect the brain's very weak magnetic fields. So this sensing device is called a Squid. It's a pretty cool name. So Squid stands for Superconducting Quantum Interference Device. So the Squid is immersed in liquid helium to keep it at low temperatures necessary for superconductivity. So one or more probes are then moved across the surface of the skull, and this will send the signals to the Squid. So here you can see technically a picture of this Squid. So each probe then produces an isocontour map, which is technically, as you can see right here, it is a chart with concentric circles, so gradient representing different intensities in the neuromagnetic field. So here in red, you can see that there's a higher magnetic field compared to in the blue. So these maps allow investigators to calculate the location of the neurons generating the field in 3 dimensions, as you can see in this picture right here. Okay, so next up we're going to talk about brain stimulation. We're going to talk about 2 parts. We're going to talk about deep brain stimulation, which is technically very invasive. And we're going to talk about transcranial magnetic stimulation. So deep brain stimulation is a very invasive method to investigate brain function and to control brain activity in certain psychiatric diseases. So it's also used in Parkinson's, for example. So deep brain stimulation, or DBS, it's used to treat a lot of neurological and also psychological disorders. So one example that I just said is for Parkinson's, and I want to talk a little bit more about that. So Parkinson's disease, as you guys all know from previous videos, is characterized by all these tremors and also akinesia, which means the absence of movement. So when DBS electrodes are implanted in the brain in a couple of regions of the basal ganglia, so for example the globus pallidus or the subthalamic nucleus, both tremors and the akinesia are lessened. So patients have reported that DBS used for Parkinson's has improved their movement, but not only movement, also their cognition and their mood. So the only limit of DBS is that it's super invasive. So as you can see in this picture, here you have the electrode, and it goes all the way into the brain, so it can stimulate, for example, in the subthalamic nuclei. So because this procedure has to go into the brain, it can even damage the brain and also introduce infections. So the other form of brain stimulation is called transcranial magnetic stimulation, or TMS. TMS is really cool, actually. TMS is a non-invasive method that allows brain stimulation through the skull. So often they use a small figure 8 form, as you can see right here, which is technically a small wire coil, and it is placed next to the skull. So it's just placed next to your head. And then a high voltage current is passed through the coil, and it pulses super duper fast. And then each electrical pulse produces a rapid increase and then a decrease in the magnetic field around the coil. So the magnetic field penetrates the skull and changes the electrical activity in adjacent neurons. So even though this sounds super intense, TMS is not harmful to the brain tissue at all. So the take-home message, what I want you to remember, is that TMS, you can technically inactivate an area of the brain tissue for just a temporary time, for a short amount of time. So you can make temporary virtual lesions in this brain region and study how it affects the brain behavior. So for example, if you put this TMS in the back of your brain, you might be temporarily blind. But then if you take it away again, you will be able to see again. So it's very temporary and it's not harmful to brain tissue at all. I think that's really cool. Okay, so let's move on to X-rays. So aside from surgeries, X-rays were the first methods that were used to look at the brain. So X-rays are still used in many hospitals, and they're a little bit fancier than they used to be. And they're especially used to look for brain tumors, for strokes, or any other abnormalities in brain vasculature. So in conventional radiography, X-rays pass through the skull onto an X-ray sensitive film, and as they travel through our heads, through our skull, these X-rays are then absorbed at different degrees by different tissues. So X-rays get absorbed a lot by bone and less by fluids, such as in ventricles or in blood vessels. So as you can see in these images, the bone is very white, and then the brain tissue is a little darker, and the ventricles are even darker. So the one thing I wanted to point out is that the gray matter and white matter almost look the same. So it's very hard to differentiate between gray matter and white matter brain tissue. So one method within the use of X-rays is called angiography, and this is a method to look at blood vessels or image blood vessels. So in Greek, angion means vessel, that's why it's named that. And technically how it works is a substance that absorbs X-rays is injected into the bloodstream, and then the presence of this material in the blood produces an image of the blood vessel. So here you can see it's probably injected lower in the body, and then it went up to the brain, And here you can see beautifully how all these blood vessels give blood to our brain. So prime examples of what angiography were used for are aneurysms or blockages or anything like that. So injecting this substance into the bloodstream is not very safe. It's a little bit dangerous and it can be painful. So now we often use other types of scanning for this, including MRI scanning. Okay, so last one, I promise, last one I want to talk about is another measure of X-ray imaging, and it's called computerized tomography or CT scanning. I'm sure you guys have heard of this. They often use this in the hospital as well. So this method involves passing a narrow X-ray beam through the same object at many different angles, and this will create many different images. So these images are then manipulated using computing and mathematical techniques, and it will then again create a three-dimensional image. So here the skull shows up as white and the tissue is a little bit darker. And again, the gray and white matter in brain tissue does not look very different in a CT scan. It's all kind of one blurry image, right? So ventricular fluid is less absorbent, so ventricles should be darker in the CT scan. You can see a tiny bit of ventricle right here. So whenever there's damage in the brain or to the head, it will show up darker in the CT scan because damaged areas have less neurons and therefore more fluid. And if the CSF in the ventricle shows up darker, this CSF should show up darker as well. So here you have an example of that. Here you have an example of a lesion. You can see right here. So most likely all these cells died off, and then eventually this was all filled up by fluid. So here you see the lesion in a drawing, and here is what it looks like in another drawing. So this person had Broca's aphasia. So this person did know all the words and did know what he wanted to say. He was just not able to pronounce the words. So this is a really important area for speech production. Okay, so what are the differences between CTs and MRIs? So they kind of look similar. You see kind of a similar picture, but there are a lot of differences. So CT is a form of X-ray, which means radiation, which means it's harmful if you have many of them. MRI uses a magnetic field and radio frequency pulses and is not harmful at all. CT is much quicker than MRI, so it's better if you need a quick diagnosis. MRI takes a long time. However, MRI does have more spatial resolution than CT, especially because you can see the gray matter really well defined from the white matter. But then again, the MRI scan is way more expensive. Okay, so here's a little recap of some information of some of the methods we went over. So single cell recordings have the highest resolution, however the lowest generalizability because you are looking at a couple neurons in a very, very specific place, and it's very invasive. EEG tells you little information about activity of a single neuron. It's pretty simple, it's pretty cheap and non-invasive. However, technically all you get is a picture of the brain. An X-ray is just a quick static snapshot, and it's good to see if there's any tissue damage or broken bones. MRI and fMRI, pretty high resolution, non-invasive, just kind of uncomfortable because you have to listen to very loud noises. And PET scan shows the biochemical status of the brain. However, it needs a radioactive tracer, but the radioactive tracer is not bad for you or anything. Okay, so it kind of depends. So they use X-rays, EEGs, MRIs, and PET scans in the hospital. Single cell recordings are not used in a hospital. This is just research. Okay, So MRI has higher detail compared to PET and also to CT. I don't think I put CT on here, did I? No. So just believe me on that one. So on the right you see a photograph. So this picture was taken of a brain from a cadaver, and before it was all cut up, they took an MRI of it. So this is the exact same picture, exact same slice. And then here you have a PET scan, and this was the plane of the image. So you can see that obviously a photo is the most clear, but you can't just chop someone's head open and take a photo. However, the MRI is pretty much next up in line. So now we went over a bunch of methods that we use to look at the brain in neuroscience, and some of them are also used in hospitals. So there are many more methods, so keep that in mind. We just went over a couple. And I think this is the end of this chapter. So I will see you guys back soon.